Assalamualaikum. My name is Nur Sarashera binti Muhammad SYUFFTY. Today, me and my team will presenting about information governance program in healthcare perspective. About the introduction of our study. With the rapid advancement of information and communication technology, healthcare organizations are increasingly using electronic health record (EHR) and digital healthcare system. Although this technology improves patient care and decision making, they also create challenges such as data quality, privacy, information security, and regulatory compliance. Information governance, or IG, help organizations manage healthcare information securely, effectively throughout its life cycle. Therefore, this study review the role of IG is in protecting patient privacy, improving information security, supporting secure information sharing, and addressing implementation challenges. For research objective, the first one is to analyze the role of information governance (IG) in protecting patient privacy in electronic health record (HER) system. The second one is to analyze the role of staff awareness and training in preventing internal data breaches within a healthcare organization. The last one is to review the challenges of implementing the IG framework in supporting secure health information exchange between various hospital information system vendor. Next, research question. The first one is how does information governance play a role in protecting patient privacy within electronic health record system? Second one, how effective are staff awareness and training program in preventing internal data breaches within that healthcare organization? The last one, challenges of IG framework implementation to support secure health information exchange among different hospital information system vendors. Research methodology. This study used the qualitative research method through systematic document analysis. Instead of collecting data from survey or interview, the researchers analyzed existing academic literature to gain in-depth understanding of information governance in healthcare. The articles were collected from Google Scholar and Emerald Insight, two reliable academic databases. To secure the findings were current and relevant, only studies published between 2019 and 2026 were included in this analysis. Next, literature review, strategy information governance. Strategy information governance, or IG, is a framework that healthcare organizations manage information effectively, securely, and systematically. Its main purpose is to ensure that healthcare information is accurate, accessible, and complies with legal ethical requirement. IG cover the entire information lifecycle from information creation until its final disposal. It also integrates several information important area, including data management, information security, risk management, compliance, and record management. According to American Health Information Management Association, or HIMA, information governance is the responsibility of the entire organization, rather than a single department. The implementing IG, healthcare organization can improve decision making, operation efficiency, and the quality of patient care. That's all from me, and I will pass to the next presenter.
So now we will talk about the challenge facing the global healthcare industry today. First, let's look at the operational side. Healthcare providers are currently performing a difficult balancing act. They are facing a high demand for service, serving thousands of the patients daily while managing rising costs. At the same time, a growing population and more chronic disease has led to the higher expectation for the quality of care. The goal for this organization is to remain financially sustainable while ensuring that the care is safe and patient-centered. The second is, we have the technological side. To meet this challenge, there is an aggressive deployment of the high-tech system such as artificial intelligence, machine learning, and the Internet of Things. While these technologies are great for the improving operational efficiency and patient outcomes, their rapid advancement is a major reason why we are seeing significantly higher healthcare spending. So let's look at the critical roles of information quality. High quality, accurate data is essential for supporting clinical decisions and conducting medical research. When we rely on poor information, the result can be dangerous, leading to the patient misdiagnosis, wasted resources, and error-prone decision-making. Second, we must navigate data security and privacy. This is a difficult balancing act between coordinate and secrecy. While departments need to share information to coordinate care, personal data must remain strictly confidential. If security is not treated seriously, it can lead to devastating privacy violation, identity theft, and healthcare fraud. To solve this problem, the industry is turning to a technical solution. We're moving to the electronic health data explosion, the benefit of HIT in modern medicine. This slide Examine the electronic health data explosion and our fundamental paradox, coordination versus secrecy. To deliver top-tier care, information must keep flow across the department. Yet, we have a strict duty to keep that personal data entirely confidential. We cannot ignore the security risk. Failing to prioritize data security leads to severe consequences, not just system vulnerability, but real privacy violation, identity theft, and healthcare fraud. So now we're addressing the dual breakdowns. As we manage this data explosion, we must overcome two primary types of friction, human and technical breakdowns. First, data integrity is a human-level issue often caused by high-pressure environments that leads to the manual entry errors. The clinical impact is dangerous, potentially leading to the missing records or a failure to administer critical treatment. Second, interoperability is a technical level breakdown caused by silo hospital, labs, and pharmacy using conflicting digital standards. This results in fragmented care coordination and poor overall impression for our patient. To moving forward, our governments must address both of the human process and technical system that hold our data. This slide examines a critical issue within the electronic health data explosion, the erosion of EHR data integrity. In a high-pressure clinical environment, the necessity of human data entries create significant challenges. This pressure makes it extremely difficult to maintain the accuracy, consistency, completeness, and reliability of patient information throughout its entire cycle. When data integrity breakdowns, the consequences are immediate and dangerous, as shown on the right. This failure often leads to the entering incorrect information into the file, loading the wrong patient record entirely, most critically failing to administer the correct medication or treatment. In summary, the protection data integrity is not just a technical goal, it is a vital part of the ensuring patient safety in the fast-paced medical settings. On this slide, we look at how to manage the electronic health data explosion to a strong information governance framework. To turn this data into a reliable access, our framework relies on four essential pillars. First, standardized data practice. This ensures that information is collected and stored using the same rules across all departments, ensuring consistency. Second, staff training. We must equip our healthcare professionals with the skill to handle data correctly, which significantly reduces the risk of human error. Third, regular audit. We perform continuous checks on our system to ensure they remain secure, accurate, and compliant with the regulation. And fourth, advanced technology. We leverage the latest digital tools to protect patient privacy and support the integrity of our data system. By focusing these four pillars, we create a stable foundation that allows us to manage massive amounts of data while keeping it to secure, useful of patient care. On this slide, we explore how the modern healthcare system generates that what can only be described as chaotic mixed complex data. To transform this information into a strategic access, we must understand the three different forms it takes. First, we have structured data. This is highly organized information that fits neatly into traditional database. Most common example including operational metrics and financial data. Second is semi-structured data. This information is only partially organized and require parsing to be fully useful. We often encode this in standardized form and system APIs. Finally, we have unstructured data. This is raw and text-heavy information that is most challenging to manage. It includes vital documents such as patient records, physician notes, and flat files. These slides detail the six-stage business intelligence (BI) value chains. We provide the architecture flow necessary to transform raw data into strategic decision. The process moves through six critical stages. First is data gathering. This is the sourcing phase where we collect our raw information. Data integration. Here, we focus on structuring that data so it is organized and usable. Third, data storage. In this stage, data is centralized to create a single source of truth. Next, data analysis. This is the interrogation phase where we look for meaningful pattern and insight. Next, data distribution. This is about delivery, ensuring the right information reach the right people. The lastly is data-driven decision. We reach the action phases where we make informed clinical or operational choices. By following these chains, we ensure that information is treated as a strategic asset rather than just a collection of facts. This slide, part of our literature review, focus on information as strategic assets and specific benefit that business intelligence or BI bring to the healthcare sector. These benefits are divided into two key areas, clinical excellence and operational impacts. First, BI is a driver for clinical excellence. It supports evidence-based medicine and enables real-time patient monitoring. By allowing for deeper treatment analysis, these tools lead to the better treatment quality and, most importantly, significantly improve patient safety. Second, we see a major operational and financial impact. BI tools help in reducing costs across the healthcare system. and are instrumental in preventing the possible of frauds. Ultimately, this efficiency leads to enhanced organizational performance, ensuring the facilities runs as effectively as possible. By leveraging BI, we transform raw data into a strategic asset that protect both patient and organizational sustainability. In this section, we explore our finding on enhancing the security and confidentiality of health information. Information governance is essential here because it establishes risk reduction mechanisms such as strict access control, risk management procedure, and accountability measures to protect data from unauthorized access or misuse across institutions. We also face a difficult task in balancing data exchange with confidentiality while sharing medical data with providers and researchers is necessary for quality care. It significantly increases privacy hazard. We must prevent data leak as they can lead to severe real-world consequences for patients, including financial loss and social discrimination. Furthermore, our governance framework must adapt to an evolving cyber threat landscape. Healthcare is increasingly targeted by emerging risks, especially ransomware attacks, cloud security vulnerability, and artificial intelligence-driven cyber risk. Because new technology constantly bring new privacy concerns, there is a vital need for continuous improvement. Organizations must commit to regularly updating their governance procedure and security measures to stay ahead of this emerging threat and keep patient data safe.
My name is LIYANA and I will explain findings 2, which is the role of staff awareness and training in preventing internal data breaches within healthcare organizations. Number 1, information governance and policies. Information governance and policy act as a control system for data security in healthcare organizations. They will set clear guidelines on how patient information should be managed and protected. And this system also ensures that staff follow security standards and rules properly. It is very important to note that data protection does not depend on technology only. Strict enforcement of policy is needed to reduce risk caused by human mistakes or carelessness in handling data. Number 2, staff awareness and training. Staff awareness and training are important to improve staff knowledge about data security. It will help staff in better understand of security policies, help staff to identify cyber risks, reduce mistake when handling data, and encourages cautious staff behavior to become more careful in daily work. Overall, training helps improve compliance with security procedures and reduce human error. Number 3, continuous training approach. Continuous training means training is not done only once but done regularly and repeatedly. And this is important because cyber threats keep changing over time. And the training can be done using short videos or videos for around 20 minutes of periodic reminders, which is the regular reminders from the system. And this method is more effective than long training session because it avoids information overload, keeps staff attention, and also helps maintain security awareness over time. This study talks about the challenges in using information governance for safe health information sharing. Firstly, there is a problem called interoperability and technical issues. This means different hospitals use different formats, technology, and also procedure. Because of this, it is hard to share, combine, and manage patient data properly. So, the information does not flow smoothly between systems like electronic health record, and this is why a standard system is needed. Secondly, there are information security and cybersecurity risks. When health data is shared through networks, it can be exposed to dangers like cyber attacks, unauthorized access, and data leaks. Systems that are connected between hospitals are easy to attack, so hospitals need strong security, regular monitoring, and good protection system. Thirdly, there is a privacy and confidentiality issues. Hospitals need to balance between making data easy to access and protecting patient privacy. If data is easy to access, the risk of information being exposed is higher. There are also ethical issues when patient data is used without proper protection. There is a regulatory and compliance challenges. Different hospitals and organizations follow different rules and policies, and this makes it difficult to create one standard system for everyone. So hospitals must follow legal ethical rules while to maintain operational efficiency. Lastly, there is organizational and governance complexity. Information governance makes cooperation between many hospitals, agencies, and locations. But it is difficult to make sure everyone follows the same rules. So a strong governance system is needed to keep everything consistent. Information governance plays a very important role in health information management in the digital era, especially through the use of electronic health records. Information governance helps ensure that patient information is managed more securely, accurately, and in compliance with established standards and regulations, thus protecting patient privacy. This study also found that the human factor is the main cause of internal data leaks, where staff error can lead to serious security risks. Therefore, awareness programs and ongoing training for staff are very effective to reduce repeated error and increase compliance with organizational security policies. Although the implementation of information governance in information sharing between hospital systems still faces challenges such as interoperability, data security, and legal issues, information governance is still needed to ensure that health information exchange can be carried out safely and with integrity. Therefore, health organizations need to continue to implement information governance, increase staff training, and improve system integration to ensure more effective health information management in an increasingly complex digital edition. Point number one, strong leadership and top management support are essential. Top management should be actively involved in making strategic IT-related decisions to ensure that innovation is encouraged, continuous improvement is implemented, and adequate financial resources are made available for the development of strategic IT assets. Without strong leadership support, information governance implementation is difficult to implement effectively. Point number two, establish multi-stakeholder governance and integrate risk management. Hospitals are recommended to establish committees that include medical representative, IT specialists, executive management, and foreign management. This is important to align project goals with organizational priorities without an hierarchical structure. In addition, IT governance should be integrated with a risk management and legal framework to ensure tight controls over cybersecurity, data breaches, and changing health regulations. Point number three, align technology implementation with clinical workflow and organizational goals. This means that any new system or technology should be carefully evaluated before implementation to ensure that it truly supports clinical and operational needs. This is important to avoid wasting resources and reduce the risk of user resistance. Apart from that, organizations are also advised to train or hire IT staff with clinical backgrounds to bridge the gap between the technical and medical fields. Point number four, strengthen communication, collaboration, and innovation culture. Management should provide clear and consistent communication channels to align technical terms with trust and avoid misunderstandings between internal units and external vendors. In addition, organizations are encouraged to create a culture of knowledge sharing through regular meetings, appreciation for diverse staff skills, and sharing digital successes to increase motivation for technological change. Point number five, improve system integration and long-term technology planning. Healthcare organizations should develop a long-term technology plan that focuses on integrating legacy systems with global data standards. This is essential to ensure that the health information can be exchanged more smoothly, securely, and effectively in an increasingly complex digital world.